Hello and welcome to another video in Foundations in Maternal and Newborn Health. In today's video, we're going to elaborate a little bit more on pharmacokinetics. So again, just as a recap, pharmacokinetics is predominantly how the body affects drugs that are taken or a drug that's taken. And so this is usually how the body breaks down the drug or how it's absorbed and then eliminated. So I think the best way to illustrate this is with a graph of the concentration of a drug within the blood over a given period of time. So this is concentration of drug over here, so higher would mean higher concentration within the blood, and then in this direction this is over time. So if we had a patient who took Tylenol here at kind of time 0, there would be no concentration of Tylenol within the blood. And then over time, the body would begin to absorb the Tylenol from the stomach and from the small intestine. It begins to absorb the Tylenol, and you would hit kind of peak concentration of Tylenol. And so this is the absorption phase. This is the absorption phase of the drug. So you've taken the Tylenol, it's been absorbed into the blood. And then the second phase is elimination. So this is when the body starts to remove the drug from the body. And so unlike absorption that happens relatively quickly, elimination takes a really long time to happen to completion. So really slowly. So this phase is elimination. And so the reason for this really slow elimination process is a concept called half-life. And I'll put it in caps because it's an important concept. Half-life. And so what this means is that over a certain amount of time, and it depends on the drug, but over a certain amount of time, the concentration within the blood of a certain drug reduces by half. So we'll go through a specific example. So Tylenol has around 2-hour half-life. It's 2 to 3 hours depending on the person, but we'll say 2 hours for this example. So if the concentration at the peak of action of Tylenol is here, then over 2 hours, the concentration should drop by approximately half. So this is 1/2 of the maximum concentration here. So this would be approximately 2 hours. After another 2 hours, you wouldn't expect Tylenol to hit 0. It's going to only go down by another half. So again, it's another 2 hours and it's gone down by half of the time, half of the amount it was 2 hours ago. And then again, another 2 hours passes and Tylenol again still hasn't hit 0. It's only gone down by another half that it was when we started, roughly 2 hours. So you can see it takes a really long time to get rid of any drug, in this case Tylenol, completely from the body. So it takes many hours. And so half-life has important clinical ramifications. So one thing to note is kind of withdrawal. So if you're addicted to a drug, your withdrawal symptoms will onset depending on how fast you eliminate the drug. This is also, of course, important for overdosing. So an important consideration with half-life is that usually you stop feeling the effects of the drug before it hits zero. So once it hits, maybe this point here, you stop feeling the effects of the drug, and so you take more of the drug or you administer more of the drug, and the body starts absorbing from here. So unlike from your first dose when it started at zero, you're not starting at zero anymore. You're starting at a higher concentration, and so your second dose usually goes much, much higher or a little higher than your first dose. So usually there's a difference between your second dose and your first dose peak. So overdosing is, of course, a risk, which half-life affects. And then the other effect is just dosing in general. And so you can think of, for example, Tylenol, which usually you give once every 4 hours of a maximum, but there are other drugs where you might take them much more frequently, where the half-life is so quick that you have to give the drug much more regularly to get an effect. Or there are other drugs where you only need to take it maybe once a day because you remove the drug so slowly. So half-life really affects all of these things. And different drugs, as I mentioned, different drugs have different half-lives. So depending on the drug, you can have a different half-life. But what's also important to note is that each person may also affect the half-life of the same drug. So there are different factors that can affect how quickly you remove a drug from the body. So one important one is liver or kidney damage. So if you have liver failure, kidney failure, for example, usually your half-life is much, much slower, is much longer. So for example, you take Tylenol and you have liver damage, it may take much, much longer to remove the drug from your body. And so that's important because in that individual, you couldn't take Tylenol every 4 hours or else you would overdose. You need to take it much more infrequently. So liver and kidney damage usually affect half-life, again, depending on the drug. And then the other important consideration is drug interactions. Drug interactions. And so some drugs are removed by the same organ. So a good example of this is Tylenol and alcohol. So both of these drugs are removed by the liver. And so if you take both at the same time, the liver has trouble removing both at the same time. And so it'll usually break down a little bit of the Tylenol and a little bit of the alcohol, and you'll end up with kind of these pieces of alcohol and Tylenol in the liver, but it's not removing it as quickly as it should be because both of these drugs are in the system at the same time. And what you end up with is actually liver damage. Liver damage. So if you take, Tylenol and alcohol once, your liver won't be happy, but it'll be okay. But if you repeatedly do this over and over and over again, you can actually end up with liver failure. But you have to do this very often. But yes, Tylenol and alcohol would be an example of drug interactions that affect the half-life of the drug within the body. So this is why pharmacokinetics is clinically relevant. It's important to note that drugs have different half-lives, and these different half-lives affect what sort of dosing you give patients. And it's also important to note sort of what background the patients have and how these backgrounds might affect the half-life of a drug and affect what sort of dose that you can give them. And so typically pharmacists are really good at knowing this sort of information of what drugs you can give together, what sort of problems that a patient might have that could affect the drug of interest.